All right, let's get into our top story, shall we? So let's talk about the big news of the day. So just, breaking news just a short time ago, before we came on the air from the Washington Post. Now, again, this is Jeff Bezos's Washington Post, okay, reporting that for the very first time, vaccinated people make up a majority of COVID deaths. This is the Washington Post headline. Just a short time ago, vaccinated people now make up a majority of COVID deaths. That is the headline. And so I want to go a little deeper into this, which is I would say a bombshell story.
Yes, it is, but it's an analysis of data. They are just, under normal circumstances, they might post this as a bombshell story, but for the most part, it's just, here's the data, guys. We'll see how much the mainstream media
it's the
picks
data,
up
though.
with it.
It's important to tell us where the data came from. It came from the CDC.
Right.
So the data came from the CDC that the Washington Post covered. Okay, so let's go through what the Washington Post says about the CDC data. For the first time, it says, a majority of Americans dying from the coronavirus received at least the primary series of the vaccine. 58% of coronavirus deaths in August were people who were vaccinated or boosted. Now, this is from August's data. This is not even September yet. According to an analysis conducted for the Health 202 by Cynthia Cox, vice president at the Kaiser Family Foundation. It's a continuation of a troubling trend that has emerged over the past year. As vaccination rates increased and new variants appeared, the share of deaths of people who were vaccinated has been steadily rising. In September 21, vaccinated people made up just 23% of coronavirus fatalities. In January and February this year, it was up to 42%. That was January, February. Per our colleagues, Fenette Narapil and Dan Keating, we can no longer say, they say, this is a pandemic of the unvaccinated.
You hear that, politicians?
We can no longer say this is a pandemic of the unvaccinated. From the Washington Post, quoting this analysis from the CDC. Here is the CDC data you can look for yourself. The Washington Post links right to it. Rates of COVID-19 cases or deaths by age group when vaccination status and booster dosage. So you can dive right into it and see it. Now, we should, of course, point out that the very last paragraph of this Washington Post story, you couldn't let us off easy, right? With just like the straight facts. You have to add in this part at the end here. Here's this quote on boosters. Being unvaccinated is still a major risk factor for dying from COVID-19. But efficacy wanes over time. And an analysis of last week from the Centers for Disease Control and Prevention highlights the need to get regular booster shots to keep one's risks of death from the coronavirus low, especially for the elderly. So that's from the Center for Disease Control. Make sure you're still getting your booster shots, says the CDC.
I don't understand how they work that out from the data. If they're telling us that more vaccinated people are dying, why this paragraph makes no sense.
Yeah, that paragraph frustrated me.
How can we?
It's like,
go ahead.
Because it's like the vaccinations are, more people are dying from that, but more people are at risk without it. Right. It's like you're saying the complete opposite thing.
But they are not giving us really the risk. We don't know because we have no COVID. We have no trials, especially for the booster that's out right now. To say something like this, you should be able to quantify it and say, we know that this booster reduces your risk of transmission or pathological COVID or hospitalization. But they can't because they only tested it on 8 mice and said sometime in December they would get around to human trials. So how, I ask you, can they say this when they just presented us with data showing the exact opposite thing?
It's a great question. It really is a great question. And, so if you can't answer those questions, you try to cover for these groups, right? And so the Atlantic came right out with a nice article saying, and the good stooge that they are, the Atlantic magazine. I've seen a lot of garbage coverage from the Atlantic magazine over the past couple of years. They really are the worst. And here's their tweet just a few minutes ago. Paxlovid, the antiviral drug, has been widely available since last spring. Yet the number of COVID deaths per day in the U.S. hasn't budged. One problem, writes Rachel Gutman, is that people aren't taking it. Who are these anti-paxers?
Oh, that's a clever new one, The Atlantic. I bet you were proud of yourself for that.
Are you guys an anti-paxer? You won't take Paxlovid? That means you're an anti-paxer. Anti-paxer. So you won't take it. You're an anti-paxer now. Okay. So Dr. Fauci, though, as he was leaving, he had a good message. He had a good message to tell all of us about what we should do. This was his final message to all of you before Thanksgiving and around the world. Like, just pay attention to Dr. Fauci. Here's what he had to say. I'm sure he's privy to this data, right? It's been there. He has access to this data. So here's what he had to say at the podium. Watch.
So my message, and my final message, maybe the final message I give you from this podium, is that please, for your own safety, for that of your family, get your updated COVID-19 shot as soon as you're eligible to protect yourself, your family, and your community. I urge you to visit vaccines.gov to find a location where you can easily get an updated vaccine. And please do it as soon as possible. Thank you.
Yesterday, so, I mean, this is a big week for Dr. Fauci. Yesterday, he gave his final COVID press conference. And then this morning, he was sworn in for a deposition as part of a lawsuit alleging that he colluded with big tech companies during the pandemic. There's a number of players in that lawsuit, right, to what their collusion was like. And what was the heart of the collusion piece of this? Like, were they conspiring with big tech to censor content to make sure that if they saw things that they didn't like about, masks, or they would censor that content? Well,
beyond that, yes. Did they also, get a pass for any kind of critical look at vaccine trials?
Right.
What was, and we saw Fauci sort of going after any doctors who wanted to speak out about this and asking tech companies to, make those doctors' lives miserable. We've seen several doctors deplatformed for just speaking about their own data and their own research. So how much of a hand did he and the U.S. government have in this, in censorship of information that was that the global population needed?
8:00 this morning, Dr. Fauci was sworn in for that deposition to give his testimony. So we're going to be watching very closely, like, what that testimony, has to say over the next couple of, we're going to see as this starts to unpack what we're allowed to know from this deposition. Go ahead, David.
I was going to say really quickly, like, there were doctors on board with Fauci at the beginning that came in with data, with like hard numbers, and they were removed from that committee. Like, it's like, we don't want your data. So that was kind of frustrating to see that happen, that he became, he never saw a single patient that we know of, that we've never heard anything. And these doctors were, and they had like hard data, and they were like, here's what we need to do. And they're like, oh no, you're out.
Yeah.
Yesterday, he was asked at the podium, does he have anything to hide? Do you have anything to hide? And, like, anything you would like to say in front of a congressional testimony, anything that you're afraid you would say in front of that congressional testimony, anything to hide? Here's what he had to say.
If there are oversight hearings, I absolutely will cooperate fully and testify before the Congress if asked. You may not know, but I've testified before the Congress a few hundred times, over the last 40 years or so. So I have no trouble testifying. We can defend and explain and stand by everything that we've said. So I have nothing to hide.
Yeah. But then a reporter tried to ask a separate follow-up question of Dr. Fauci, a reporter from Africa, tried to ask him about the origins of COVID, about, like funding of that. Were you responsible? Who was responsible for the origins of COVID and the funding of that? What did he know about this? And then this unbelievable moment happened at the White House. Watch.
Dr. Fauci, only 13% of...
Hold on one second. We have a process here. I'm not calling out on people who yell. And you're being disrespectful to your colleagues, and you're being disrespectful to our guests. I will not call on you if you yell. And also, you're taking time off the clock, because Dr. Fauci has to leave in a couple of minutes. I'm done. I'm not getting into a back and forth with you. Go ahead, Jeremy.
Dr.
Who was yelling?
Only 30.
Go ahead, Jeremy.
You ask your question, you should allow her to ask the question.
Jeremy,
She's asking a valid
Jeremy,
question, Dr. Fauci,
it's
on the origin of COVID-19.
It is not your turn.
No, because
It is not your turn.
You can't on the same people. That's the thing. You can't read a press briefing. You need to call from people across the room. She has a valid question. She's asking about the origin of COVID-19.
I hear the question.
And Dr. Fauci is the best person to answer
I
that
hear your question, but we're not doing this the way you want it. This is a disrespectful. It is. I'm done. Simon, I'm done. Simon, I'm done. I'm done with you right now. Go ahead. Go ahead. Go ahead. You're taking time away from your colleagues. Go ahead.
Only 13% of it.
I mean, everybody was yelling, first of all.
We will not tolerate questions. We will not tolerate questions on the virus origins because of what? Dr. Fauci's involvement in gain-of-function research?
And, you know, it strikes me like this Kim Iverson story, how she walked away from the media outlet that she was in because they wouldn't let her face Fauci with tough questions.
Right.
And they said, oh, no, we only are going to give you the softball anchors. It definitely can't be Kim.
Right.
And they wouldn't even go back around to protect him. And they were like, he's got a heart out. So, I mean, he served the country as an infectious disease specialist during a pandemic and way before. I don't know where he has to go that's more important than like answering for his service.
He's got to go. He's leaving his job.
Like, he's got a heart out.
Like,
for what? MSNBC? You
right,
know, like
what,
we deserve real questions, not like, will you show up at the depositions? That's nice. You know, are you taking a desk clock? What, you know?
So his only mission there at this podium yesterday was to tell the American people to take, another bivalent booster, and which he claims was more effective against the latest strain of COVID. So, and he knows that there's only 13% of the country that's where the population has taken this booster. So was that his message? Like, I got to get this out here before Thanksgiving. I got these biopharmaceutical companies right now riding my back. Yeah.
Yeah, their profits must be slightly down a little bit. They must be just on a little slight down trajectory. So they're like, over the holidays, we really got to push this message, because I've seen it everywhere this past week on Twitter and everything.
Oh, I have seen the advertisements. I was watching an NFL game this past weekend, and there were like Pfizer ads, like during the NFL games. Like, so they have the millions of dollars to spend on these ads on during the middle of NFL football games.
Yeah.
To get you to take these drugs. Take the Paxlovid. Take it, right? That's what, if you feel COVID coming on, you're getting a little sore throat, get tested, and then call up your physician and get information about this for your bivalent boosters. So that was Dr. Fauci, but I guess we haven't heard the last of him, because he says he'll come back in front of Congress for any of these congressional hearings. And I can't wait to find out what information we'll get from the depositions through this lawsuit. So the Missouri Attorney General Eric Schmidt, along with the Louisiana Attorney General Jeff Landry, filed a lawsuit against the Biden administration, including Biden himself, Dr. Fauci, the Department of Homeland Security, and nearly a dozen federal agencies and secretaries. And of course, the suit alleges a massive coordinated effort by the deep state to work with big tech to censor and manipulate Americans around this. So Jim Hoff from the Gateway Pundit is there as well. And of course, we're waiting. He said he got sworn in, so I can't wait to see. Will we get to see the deposition?
That Jen Psaki had filed her deposition saying she should not be deposed,
right?
Because she's very busy and she has a family life and she can't properly prepare for this.
Yeah, she said she had a new MSNBC show.
Well, she didn't really say that in the filing, but she just said she's very busy in the news and she has a family, and being deposed would be, she used the word unduly burdensome, although a deposition is unduly burdensome on everybody. That is kind of the scare tactic that lawyers use.
Well, and if she got convicted, was she gonna be like, oh, I'm sorry, I just, there's no way I can go to jail right now. I've got my show, I've got kids, like, I just can't.
She's not up for any kind of, she could, I mean, I don't think, is she personally named in the suit? I don't think she is. I'd have to look back. We did a segment on this about 2 weeks ago.
Yeah.
She might be, actually. And she is also representing herself. So us, the taxpayers, are not representing her. I'm sorry, I don't remember. But I think what they would want from her if they win, would either be some kind of apology or some kind of, I don't think they would get money from her. She wouldn't get punished with jail time or anything like that. But she might have to stop doing what she's doing. They could get some kind of stay or public apology. I would be listening.
At the very least, I'd like to see her wear an ankle bracelet,
That's not what this is. This is not what this is.
It's not your ankle bracelet fetish is going to have to wait. I know you've got a thing for ankle bracelets. You have to wait on that.
Yeah, I can't help it.
We've got more news to get to on the old broadcast today. Hey, is our signal looking okay now? Hopefully. I know
we are good. I know what happened. We overloaded the server. I was recording a different format today to lower the size of it, and it overloaded the server. So that was on me.
Okay, so that's good. So is that what also happened at the end of the show yesterday? Same thing?
No, that was internet.
Oh, okay. All right. Good. Yesterday was my internet. Yeah. Our problem here in our studio. Today, David. Got it. Just want to be clear on that. I always like to give attribution. Hey, by the way, speaking of attribution, we're going to go on, but I wanted to give a shout out to last night. We featured a clip here from Thomas Binder, a doctor who was on with Taylor Hudak. She's a journalist. And unfortunately, the clip had no name at the bottom, and I didn't manage to give a shout out to Taylor, who's an independent journalist at thelastAmericanVagabond.com, does great work. And so this clip we featured last night from Dr. Thomas Binder. And anyway, I just wanted to give a shout out to other independent journalists who are doing great work. She's a contributor to the Children's Health Defense as well, which is, keep your hands off our children. Also a free speech advocate and doing some great journalism. So Taylor, thank you for continued work. Thank you for the shout out and the kind words about our show. And everyone should follow Taylor on Twitter as well, and the journalism there.